Hey, what's going on, y'all? This is Jackie, and today I'm making a video talking about an article that I saw that hospitals should track violent incidents like medical errors. So, this article originally appeared in the New York Times on October 24th, and it was written by Dr. Helen Oyang, and she is a emergency physician and associate professor of emergency medicine at Columbia University Irving Medical Center in New York City. And basically, what she's saying is that hospitals should prioritize the safety of medical professionals, especially those in the ER. Now, we know that patients get violent, family members get violent. I made videos, and I'll link them at the end of this video. I made videos talking about, the violence in the hospitals. And as recently, I think people knew about it, but it wasn't really, really, really a big deal outside the hospital until the pandemic. And now you are seeing states, legislation, passing laws to deal with the violence. So we are seeing movement there, but it's still a lot of violence in the hospitals. Okay. Now, some hospitals have started to use electronic flags in the patient's charts to indicate that the patient has threatened or assaulted staff in the past. And that's a good thing. But what this doctor is suggesting, what she wrote in the article, in the New York Times article, is that she wants these attacks. So whenever a patient attacks a doctor or medical staff, she wants these attacks, these incidents. Let me just use the word incidents. She wants these incidents to be tracked like we track medical errors. So, an example of a medical error, if you work in a hospital, you know about the CLABSI. And the CLABSI is CLABSI. And the CLABSI stand for Central Line Associated Bloodstream Infection. If I don't know nothing else, I know what a CLABSI is because it was like the hospital was having too many and they made it a big deal. Okay. And they kept track of the collapses and how many collapses we had this month. And it was a mess. Okay. And this a long time ago when I worked on the med surge. So I know what that is. So it's like, it's not only just, flagging the chart, but also they want the hospital to track it. They want the administration to see that. You know what I'm saying? Like they want to say, hey, we had an incident here, incident here, incident here, incident on this day. We had an incident on this day. Just like you track anything else. So that's what the doctor want. And I agree that yes, it should be tracked, but the only thing I would caution on is that sometimes patients are violent. Now, this is coming from someone who worked on the med surg floor and someone who worked in ICU. I never worked in the ER, so the ER is a different beast in itself. Okay, but from someone who worked in the med surg and in ICU, sometimes patients are violent because of the medication that they're given. Right, so some people are just not. Some people are not violent. It's just now some people are violent. Okay, they got issues. Okay, but some people are an incident may occur because of the medication. So like my mom, for example, my mom's a nurse. My mom, when she has if she has a procedure and she gets anesthesia, when she's coming out that anesthesia, when it's wearing off, my mom is violent. My mom is kicking and scratching and don't, because she it's the anesthesia. We tell the doctors, she tells the doctors beforehand. She's like, look, I'm gonna tell you now, you can give me anesthesia, but I'm gonna come out kicking and fighting because that's just what the medicine does to her. It that's what it does. Now me, I'm sleepy. When I had my procedure and they gave me anesthesia, I went right to sleep. And when I woke up, it took a long time for me to really really wake up. Some people are like that. So sometimes the medication the person is on, it does something to them. Just like people would get on some kind of medication, they'll hallucinate. They'll see people, they see ants, they see this, they see bugs. They sometimes it's the medication. Now, when it's the family acting up, okay, when it's the visitors acting up, we don't know what they on. You know what I'm saying? They could be on something, they could not be on something. That could just be them. But like when it comes to the patient, sometimes it's the medicine. So I'm a little sensitive for that part. But do I think that the incident should be tracked like medical errors? Yes, I totally agree. So one of the things that um, the doctor feels that tracking this would do, it would either because if the hospitals can take a look and say, okay, this happened here, stuff always happens here, we can put security in this area, or we can get panic buttons, okay, or things like that. So what do you think? Should hospitals track violent patients or violent incidents like they track medical errors? Well, that's all I got for you today. If you got any questions or comments, you can put them below. Don't forget to like the video, share the video, and subscribe to the channel. And I'll talk to you later.